Hi, everyone. Dr. Lulu here, and welcome back to the Genetic Genius Vibe. And I'm going to be talking all about menopause today, is specifically hot flashes and causes and natural solutions. This is a big hot topic, so to speak. And lots of women not only are suffering from them, but don't understand the aspect of how the hormones are working in the system and what solutions to do, because there's lots of great alternative health solutions. So I wanted to talk about that today. So first of all, what categorizes menopause? So menopause is official when you haven't had your cycle for 12 months in a row. So if you're in perimenopause, which can start as early as age 30, sometimes earlier, where you're skipping cycles and things like that, it doesn't officially become menopause until that occurs, or you have 12 months without any cycle or any bleeding. So the other part of how the hormones are working in regards to menopause is that your body starts reducing the amount of estrogen and progesterone emitted from the ovaries. So this really starts to change the way the female cycle works, the way that the body works, the responses, which can be many different types of things, running from hot flashes to insomnia to weight gain to mood changes. There's many different things that can go along with menopause. And the real key aspect is addressing the cycle before menopause hits. So if you already are in a state as a female where you're having these difficult cycles with lots of PMS, lots of cramping, lots of symptoms, heavy bleeding, you want to make sure you're being proactive before you move into the menopause phase so that your cycles or your you want to be really proactive moving into the menopause phase so that your symptoms of menopause are very little, right? So you're not having a really challenging menopausal phase. So when the reproductive hormones change, the decrease in estrogen is the main hormone that's responsible for the menopausal symptoms. And that can be, like I said, anything from hot flashes to vaginal dryness is a big one, as well as insomnia, irritability, anger, mood changes, very erratic up and down. And so when these start to occur, there's lots of solutions that I'm going to be talking about today. So it's really common to have sleep disturbances with menopause, and that's mainly due to the change in temperature, which comes from the hypothalamus gland situated in the middle of the brain, which is communicating with the pituitary gland and the hormones coming out of the system. And also the ovaries and the thyroid gland and the adrenal system. So all of those are connected to the response of the hormones in the body. During the sleep period, right? This is the most common time women will have hot flashes and disturbance of sleep, but you can also have hot flashes during the day. And those are very common as well. And so you can take herbs, for instance, I'm going to be talking about those. You can take herbs to help with that throughout the day, and other things like diet and exercise can really help to benefit the erratic changes of the body's temperature. So let's talk about some tips for improving sleep, because I think this is one of the main things I hear most from my patients and women who are suffering through menopause. Here are some great tips for helping to sleep through the night. So, one, keep your room cooler. And there's even mattresses that you can purchase that actually have a temperature now where you can keep the mattress itself cool, which is a great thing that can help, especially if you have a lot of hot flashes in the night where you're waking up and all the sheets are soaked and you have to get up and change your clothes and sheets. So keeping the room cooler can be a great one. Decreasing the amount of caffeine intake. So I really recommend if you're going to be drinking caffeine as coffee, to have one early in the morning and not throughout the day, because it's going to increase your blood pressure. It's going to increase your chance of having a hot flash. So switching to a lower caffeine or herbal teas and or a green tea with high in antioxidants, that can help a lot with hot flashes. You want to avoid drinking a lot of water about 1 to 2 hours before bed. This is going to help you sleep better throughout the night without waking up. Because once you wake up, then you are going to have a higher chance of a hot flash occurring. Have a really great calming bed routine. And this part is really important because we want to decrease our stress hormone cortisol, which is affecting the adrenal system, affecting all the other hormones. So a really great bedtime routine, whether that's reading a nice book, having no digital or electronic interference, right? We're at least an hour before bed, turning off your TV, your phone, your iPad, etc. This is really going to help your body to come into that calm state, into that parasympathetic state, that resting and digesting, and balance all the neurotransmitters coming from your brain, communicating with the body, and the hormones going back and forth. And then also having a small protein snack before bed can be very helpful, whether that's use just a handful of nuts or some hummus, a little small animal protein. What this is going to do is it's going to help balance your blood sugar so you don't wake up in the middle of the night. And also it's going to help balance your adrenal system. And your adrenal system has part of the adrenal system is your reproductive organ. So it really helps with that. But your adrenal system also balances blood sugar. So very important to have this system balanced. So let's talk about some superfoods. Now, when it comes to nutrition and diet specifically and I'm going to talk about, this is really geared towards helping to reduce hot flashes. So you want to have a great whole foods diet. And that's with high fruit, high in vegetables, whole grains, legumes, increasing your seed intake of flax seeds and chia seeds. This can be very helpful. Reducing really high animal fats and simple carbs that are going to go right into sugar, which is going to change your adrenal system's way that it balances blood sugar. So having a complex carbohydrate is much better. And then these are my favorite go-to superfoods. I love using mushrooms, medicinal mushrooms. So chaga and reishi, these are great options. As far as protein, adding in quinoa, this is a great one to add in. You can even have a breakfast or as a salad or as a dinner option. You can mix it in. You can have it as sweet or savory. It's a really great one to help balance out protein and help sustain energy throughout the day. Again, I mentioned the seeds. So chia seeds and flax seeds, these are great for a seed rotation diet to really help to balance the hormones, as well as adding into smoothies for protein. I also really like spirulina. Spirulina is a wonderful plant, and it's one of the things that's really good for that I like to use it in menopause is really helping to detox the system, because we're having the change in the way we are cycling. We're not bleeding as often, or we're not bleeding. And so we need to have this time every month that we're helping the body to detox, because we've lost our natural detox mechanism. So spirulina will help detox the body, but it also is going to give the cells lots of energy. So it's a really great one to bring in there. Okay, let's talk. So that's a superfood. Superfoods are a great way to bring in. So bringing in some of those superfoods, and you can bring them in lots of different ways. You can bring them into a smoothie. You could bring them into a power food coffee in the morning. That's a great one to bring. Or you can make a green tea, bring some of those herbs in, or you can bake them in a smoothie. There's lots of different ways. You can even add them to a soup. Really start bringing them in through the different meals throughout the day. This is going to really help balance your hot flashes, especially if you're addressing those superfoods and some of the herbs I'm going to talk about through all the different times of the day. So when you take this menopausal strategy, so another piece is you really want to be tracking your cycle with a good app on your phone, because you want to see, are you really going into menopause? Are you in perimenopause? Are you in menopause or postmenopause? What phase are you in? So you can have those specific tracking devices so that you can talk about it with myself or your health practitioner, so that you're empowered about where you are in your cycle and what symptoms you're having at what times of the month. So let's talk about exercise. Exercise is a really important piece to bring in to help with hot flashes. That's weight bearing, strength training, aerobic exercise. And if you're having a lot of joint pain, which can be common, and because weight gain can be a shift as we're moving into menopause as women, and the changes in hormones and the thyroid gland and the hormone shifting can sometimes lead to weight gain. So exercise is very important. And aerobic exercise is going to increase that circulation throughout the body, helping the blood go back through the liver, which is then going to help the production and clearing of the hormones in the body, detoxing of phase 1 and phase 2. So super important for the system. Now, as far as herbs go, there's lots of really great herbs I love for helping with hot flashes. So I want to talk about maca first. Maca is one of my favorite herbs to use. It's a root and it's very sweet if you haven't had it before. It's really great. It's an adaptogen. So it's helping our body to adapt to stress. It's helping our body to adapt if we're in a higher place of stress, to reduce that stress, helping to balance cortisol levels. It's also really great for grounding because it's a root. So it really helps to ground. I love to have it in the morning with reishi and ashwagandha. It makes a really great hormonal coffee in the morning, or superfood. That's a really good one to bring in. It also has a really wonderful sweet flavor, almost like malt. So it can satisfy that sweet craving either in the morning or throughout the day. Now, black cohosh is one of, probably I would say, the most well known for women in the menopausal phase, as well as for hot flashes. It's really great for irritability and sleep. So that's a really good one to bring in as well. Now, I talked about maca from the adaptogenic standpoint. So adaptogens are herbs that help us adapt. Main ones I'm talking about today help us to adapt to stress. So ginseng is wonderful for helping support the hypothalamus when it comes to hot flashes. So hypothalamus is our switching station in the brain for temperature. It's our temperature gauge. So when we use ginseng, it helps us to adapt to stress. It helps to that the hypothalamus gland to actually more efficiently, when it's gearing up for a hot flash, it'll reduce those hot flash symptoms. It also helps the adrenal system balance with cortisol levels and reduce stress. So ginseng is a great one. Ashwagandha is also fabulous for reducing stress during menopause. And no, the stressful piece of menopause could be that the symptoms are causing you stress, but it could also be external factors of stress. So you want to make sure that you are addressing the stress in your life, bringing in some mindset components, right? So that could be breathing exercises, meditation, visualization, to really helping to reset the nervous system, really to reset the parasympathetic nervous system, bringing your body into the resting and digesting and getting out of that sympathetic state, really resetting the whole spine and nervous system. And breath work is really great for that. Another thing I like is evening primrose oil. Now, this has high in GLA and LA fats, or gamma linoleic acid and linoleic acid. So these are really great for relief of hot flashes. So hands down, bringing in healthy fats, the omega, specifically evening primrose oil. This is going to be a really great way to reduce the symptoms of hot flashes and hot flashes in general, because it's going to increase prostaglandins. So I definitely recommend bringing on evening primrose oil. Some of the other herbs, I love to bring on a liver supportive herbs. And I really like burdock root. One, it's really grounding. Again, the bringing on a liver supportive herb is going to help move things through the liver. You can also eat it without as a tincture, but you can eat it in soup. So you can buy it at the store. You can chop it up and pickle it. So there's lots of forms that you can use it. It is a little bit on the sweet side, and it's really great and grounding. So I love bringing that in. Now, hops is a wonderful bitter. It also is going to help from the perspective of phytoestrogens. So some of our phytoestrogens, these are great to bring in during the menopausal period. So we have red clover is a great one, and hops is a wonderful one. And both of those, so hops is going to be from the relaxing piece. It's going to calm the nervous system and really help to wind things down. And red clover is really going to balance the hormones from the phytoestrogen perspective. Now, if you're having a lot of anxiety and depression, specifically during the menopausal phase, bringing in St. John's wort is a really good one to bring in. I really like the beautiful, lovely yellow flower of St. John's wort. It's very nurturing. It helps bring out the communication from the fifth chakra. It really helps us to express our feelings during menopause and not hold them in, and express them to others about how we're feeling with this change in our life as women. Very important. So that's a really good one. Motherwort is also a fabulous herb. This one is really good if you're the kind of that type A personality and you're getting easily irritable and angered in situations. Motherwort is a fabulous one to bring in to really help to calm the system. And it's, the Latin name is Leonaris cardiaca. And I always think about the lion roaring and these crazy situations. You're like out of control. And that's when that menopause is roaring its lion head. This is a really good one to bring in. So those are just some of my good herbs that I recommend. And of course, if you're listening to this, always check with your health practitioner before you're starting a new program. Like start checking with a practitioner like myself or another alternative health practitioner before you bring on herbs to make sure there's no contraindications in your current health plan. Now, when it comes to bioidentical hormone therapy treatment, I really recommend checking for sure with a health practitioner before you bring that on. But there are really great ones to bring on. So, bringing in a progesterone cream as or as progesterone suppository can be a really great one for reducing hot flashes. And also, you can use an estrogen and progesterone capsule. So, these are bioidentical hormones that will help. Remember how I talked about at the beginning that your body reduces the amount of estrogen and progesterone during the menopausal phase. So this is like giving your body that kick. And you want to really bring these on earlier in. It's usually recommended for under the age of 60 as you're starting to experience or possibly experiencing hot flash symptoms. Then you can look at that and see if these are a good fit for your health routine. So those are some of my great tips for really helping with menopausal symptoms, specifically hot flashes. And if you're looking for more help, reach out to me. This month, I have an amazing workshop. I'm going to be teaching all about menopause and more tips on how to really reset your body. It's called Mastering Menopause, a really fabulous one. So you'll see that coming on. So make sure you're following or checking in my bio about that. Thanks again for tuning in today. And I hope you learned a lot about helping your body in mastering menopause, helping to really get a handle on hot flashes, but really to help you in the transition phase to become the most amazing woman that you are for the rest of your life. So thanks again, and I'll see you next week.